All right, we are about to start with our next session, so I would like to quickly introduce Dr. Davis and Dr. Johnson up on the stage. So if you'd like to, you can come on up. So Dr. Davis is a double board certified in anesthesiology and interventional pain management. He's a native-born Texan who studies physics at the University of Texas at Arlington as a member of the Alpha Phi Honor Society. He completed his internship in medicine and pediatrics at Scott and White Memorial Hospital and his residency at University of North Carolina at Chapel Hill. He was the director of anesthesiology at Fayette Memorial Hospital in LaGrange, Texas from 1995 until 2000, and has been an active member of the American Society of Interventional Pain Physicians and the president of Interventional Pain Management since 2000. Dr. Davis has a special passion for pursuing the investigation of stem cell administration for neurologic conditions such as MS, Parkinson's disease, dementia, stroke, peripheral neuropathy, spinal and neuropathic pain, and in particular, spinal cord injury and traumatic brain injury. To this end, he has pioneered the use of C1 and C2 intrathecal injection of SPF, which we believe now allows a greater concentration of stem cells to access the brain and spinal cord. These are specialized placements are conducted under fluoroscopic guidance in his in-office surgical suite under sedation. Now I'd also like to introduce Dr. Bill Johnson, who is a native of Dallas, Texas, and graduated with honors in pre-medicine from Texas Tech University. He then received his medical degree from Texas Tech University in 1981 and completed residency in internal medicine at the school from 1984. He is board certified in internal medicine. From 1984 until 2000, Dr. Johnson practiced internal medicine as a partner at the Lubbock Diagnostic Clinic, serving many of those years as the president of the group. Dr. Johnson had a long-standing interest in the benefits of stem cell therapy and the ability of stem cells to truly rejuvenate or replace diseased or damaged tissue. He saw that the benefits of stem cell therapy in action, which were seen in significant improvements in heart failure patients when attending a stem cell conference in January 2013. This experience was the catalyst behind the opening of Innovation Stem Cell Center later that year. Dr. Johnson says that stem cell therapy is one of the most rewarding facets of his over 30-year medical career. Currently, Innovation Stem Cell Center has locations in both Dallas, Frisco, and Fort Worth, Texas. So without further ado, I will let them go ahead and speak.
And just to be clear, I'm Dr. Johnson, that's Dr. Davis. In my prior years, I put together conferences like these. And one of the things that they tell you when you put together conferences is you always put your most dynamic, in particular your funniest speaker, right after lunch, so they can help everyone stay awake. So unfortunately for you guys, these guys didn't take that course, and I'm not the funny one. But we will see if we can keep you awake. We're going to talk about stem cells, but we're going to talk specifically about stem cells from your own fat. How many of you have heard of or feel like you know what a stem cell is? That's most of you. How many of you have done some significant research and really feel like you could explain to me what a stem cell is? A couple, okay. Stem cells are cells that have two particular characteristics that make them different. I want to go over, this is we're going to talk a little bit today about what stem cells are and just some basic concepts. We're going to emphasize a little bit about getting them from fat. We'll talk about how we use the cells we get from the fat. Then we're going to focus on pediatric and head trauma issues a bit and kind of summarize. Stem cells are cells that can do two things that adult cells in our bodies can't do. One, they can produce new copies of themselves. Most of the adult cells in our bodies can't do that. If you've got a cell in your body that replicates, that makes new skin, for example, that's a stem cell that did that. The regular adult skin cells have minimal ability to replicate. The other thing stem cells can do is they can differentiate from one cell type to another. So we know, for example, you can take a bone marrow cell and make an eye cell, or a neuron, or a muscle cell. You can do those with fat cells as well. So stem cells share those two characteristics. They can replicate and they can make new copies. So that's kind of the most basic definition. Embryonic stem cells have a long history here in the United States of being very controversial, with some degree of justification for that, because the main place that we get embryonic stem cells are from stored fetuses that have been stored for future use with in vitro fertilization. There are some ethical issues with that, and so in this country, embryonic cells aren't used. What's important to understand, though, is embryonic cells have the potential, in fact, do make every single tissue, every single organ, every single functioning part of our bodies as we grow up in the womb and as we grow in life. So these cells have the potential, literally, to build anything that our bodies do, because they're the cells that did it. And therein lies the real excitement and the real power of stem cells. Now, umbilical cord cells are quite common nowadays in the United States. They're becoming increasingly common as many more people store their children's umbilical cord cells, and as umbilical cord cells that aren't stored for the child are donated and stored for someone else. The advantage of umbilical cord cells is there's no harvest, they're easy, they're fairly plentiful. The disadvantage is they have the DNA of the host. So for that baby, it's their cells. For anyone else, it's someone else's cells. And we'll talk a little bit about that. If you look at the research on pediatric, though, especially pediatric neurology, almost every study has been done using umbilical cord blood. It's been by far the most commonly used. The problems with umbilical cord blood are they usually use it all up when they do a treatment, so it's a one-time treatment thing. And two is if you didn't have your child's cord blood stored, then you don't have it. It's not available. Placental cells are used some here in the United States as well. And they're a mixture of both maternal and fetal cells. So you're only getting the DNA from two different individuals with placental. That makes it a little less desirable. There's also an underlying concern on placental cells that the placenta is a tissue with programmed death. It's programmed to survive 9 months and then die. And there are concerns that even if you can get those tissues and those cells to continue to grow in a plate, that they may still someday express that natural tendency for early death. So umbilical, for most people, placental cells are not viewed as an optimal source. Adult stem cells are the other kind. And most of the tissues of our body have adult stem cells. Neurons, very few. For example, with very few. There are neural stem cells, but there are a lot of them. The areas that they're really abundant are bone marrow, which all of us have heard about bone marrow transplants. And nowadays, those are more correctly being referred to as stem cell transplants. But in the 80s, when they first started, they've always been referred to as bone marrow transplants. And it's always only been stem cells that worked with anyone that had a bone marrow transplant. So anyone you ever heard of that had a bone marrow transplant really had a stem cell transplant. That's what happened. So adult stem cells also can be found in your fat. And here's the thing that most people aren't aware of. There's about 1,000 times as many fat stem cells as there are bone marrow stem cells. It's much more plentiful a source than bone marrow. The advantage is there's no ethical issues. It's an adult cells, you can easily harvest them, and it's got your DNA, so it can't be rejected. So if I take your cells and give them back to you, there's not a chance of reaction or rejection. How do stem cells heal? I like to use the example of if you cut your finger. If you cut your finger on a piece of paper or a knife, first thing that happens is those damaged cells release chemical messengers called growth factors. So those growth factors call out to the body and say, come help me, I'm hurt. First thing that happens is white blood cells respond. They climb up, clean up all the damage, get rid of any infection. Then stem cells respond, they come in and heal the wound, grow new tissue. So it's in response to that all of the healing in our body happens that way. All of it's when something is damaged, growth factors are released. When that occurs, those new cells come in to help. The stem cells and white blood cells come in to help. It's when those either aren't available, like in neurologic injuries, because there's so few available, or when the system is deranged, like with rheumatoid arthritis or other diseases, that's when healing does not occur well. So we're going to talk about adipose-derived. Adipose is the name for fat. Adipose-derived stem cells. We do it under local anesthesia. We numb an area about this big. We take about that much fat. That typically yields somewhere between 10 is a really low harvest and 300 million cells. So we prepare them then by putting them in a centrifuge to separate them. And then there are a lot of ways to separate the stem cells from the adult fat. We like to use collagenase, which dissolves the proteins holding the stem cells in and gluing them to the other cells. So that when we centrifuge it a second time, we have the stem cells by themselves. So we remove those cells at the end and have the stem cells. So that's an actual picture of us harvesting the fat. Have a syringe, we'll go back on the syringe for suction. Have a cannula, make an incision about 1/4 inch. After the area's been numbed, we go harvest some fat. Put it in the centrifuge a few times, mix it with collagenase. And in about an hour, if we're going to do it, we all process it twice to increase the yield. So in about 2 hours, we've got stromal vascular fraction, which is the name technically for when the stem cells have been prepared and being used in the same day. Okay? So how do we use them? We can put them directly into an injured joint or injured area. More difficult areas like the spine or neck, we will do under x-ray, the injections. We can inject them intravenously. We can inject them into the spinal cord, either down here or at the base of the brain, or even directly into the ventricles with the proper cord. We can also put them in the soft tissue areas that are hurt. And we almost always use IVs, and occasionally we use IV medications to enhance their results. So right now, those are the most commonly used deployment methods. We're part of a, Dr. Davis and I are part of a network of doctors, about 100 of us across the country, that do all of this the same way. We harvest the same way, we process the same way, we use the cells the same way, and we put everything into a common database. As of about May of this year, our network had done 9,000 cases. There was one incident of a lady that was already going blind, losing the rest of her vision when she had the cells injected directly into her eye. Beyond that, there have been no adverse effects over about a 6-year period. So lots of cases out there, it's very safe. Who should consider it? Those that are looking at treatments that they don't like, high incidence of side effects, like joint replacement or having to take steroids. Those that treatment options are not effective, those with peripheral neuropathy or COPD. Autism is another one we'll talk about in a minute. Treatment options aren't available, like most of what you guys are talking about. You're doing all the things you can do, you're doing all the therapy there is to do, still not seeing the results because therapy unfortunately can't regenerate neural tissue. So those are another area where this is a real promise for the future. Chronic pain is a real issue that these address quite well. chronic soft tissue injuries, overuse type injuries, chronic back pain. We're also seeing some good results with muscular dystrophy and some other muscular disorders. So we do quite a bit of adult neurology. I'm an internist, that means I'm a pediatrician for adults, okay, by my original training. So, and all of our protocols from the network predominantly are for age 15 and up. We've done some children, but not a lot of children. But with these disorders, Parkinson's, multiple sclerosis, neuropathy, Alzheimer's, we've seen some benefit in all of these areas using stem cells. In particular, multiple sclerosis, some patients have really remarkable results. Neuropathy, we have about an 85% response rate on neuropathy, so we do very well there. And we've had some good results. Dr. Dave's going to talk to you about some of the stroke victims that has some really remarkable results. So, moving quickly, let's talk a little bit about some of the studies that are out there. In autism, the Duke has been the leader in this, and they've done really two different studies. One that has shown significant improvement using the child's own cord blood in a single dose. The other has shown that there's a dose relationship, so there is a certain amount of stem cells that you have to have in order to evoke a result. It's also what the Sutter folks found in Sacramento. There's what you call a crossover trial. So the first round, half the kids got stem cells and half got saline. The second half it swapped who got what, and the treatment group got better each time. So really felt like it was related to the treatment. So cerebral palsy, you know, a little closer to what most of you guys are interested in. Cerebral palsy, there's also been several studies. Again, Duke is a real leader. Single dose of autologous cells, again, using cord blood, improved motor function significantly. Another study done at Duke that was placebo-controlled also showed there's a dosage relationship. You have to get to a certain number of cells before you start seeing a response. There's a study out of Xi'an, which for any of you that haven't been to China is where the terracotta soldiers are all located. They did 4 doses of someone else's cord blood used on CP, and the treatment group showed significant improvement. There were no adverse side effects, even though they were using other people's cord blood. Then there's one in Korea where they actually took, and this is going to be a theme in the future, because they took one of these growth factors I talked about called erythropoietin, which is what stimulates our bone marrow to produce erythroid cells. And they treated the stem cells with erythropoietin and then gave it. And the stem cell group did significantly better with cerebral palsy than the non-treatment group. Now, brain injuries, there are a number of studies in animals that have shown effect. One of the founders of our network, his son did his master's thesis doing controlled concussions on rats. So they give a rat a concussion, rat had been trained to go get a cheese prize at the end of a water maze. So you give a concussion to a rat, and the next day they can't find the cheese anymore. About a weekend, about half the rats start getting where they can find the cheese again. At 3 weeks, there's always about 10 to 20% of the rats that can still never find the cheese. About 8% of them recover. None of them return to their baseline speed. Now, 3 days after the concussion, give them stem cells. By 5 days after the concussion, they're finding the cheese. By 3 weeks, they're faster than they ever were before. So there's increasing evidence now that stem cells have a huge protective effect at the time of neurologic injury. And it's really a mystery to me why we're not utilizing this here in the United States regularly, because the data is pretty impressive. Beijing, China, they looked at the people that had been in a car wreck, and they gave them 4 doses of someone else's cord blood within a few days after the car wreck, and some of them didn't get it. And the group that got it had significant improvement in their neurologic function very rapidly compared to the group that got placebo. And there were no side effects. It was completely safe. They couldn't tell the difference in adverse effects between the two groups. University of Southern Florida has proposed using a different growth factor called granulite stimulating factor, leukogen, for some of you that may have heard of it. And it appears to provide a framework in the brain for the cells to implant on and start working. So this is probably going to be one of the things we see happen over the next few years. Is we're going to start using growth factors and other things to help the stem cells have something to work on and have a basis to grow. In University of Korea, they use umbilical cord blood to traumatic brain injury patients, and again, all the patients got better that were treated with stem cells. So the future, right now in the United States, you can believe this or not, if I take your own fat, take out your stem cells, have them frozen or stored, we can grow all you want. Stem cells grow. That's what makes them stem cells. Remember, they can expand and become more cells. So I can grow all the cells that you want, but here's the problem. I can have 100 billion on storage, but I can't use them inside the United States. If you want to use them, you have to leave the country. So we can store them all we want. We can harvest them all we want. We can grow them all we want. We just can't use them. That's what the current FDA rules are. So, because one of the things that's important with neurologic injuries, more and more is going to require multiple treatments. How many? Great question. I have no idea the answer. No one's done enough. 4 is about the most anyone's done. No one's done 4 that I can find in the literature with your own cells. So, how much, how often, how many? Very appropriate questions that we don't have answers for yet. We're also going to see more and more studies using other growth factors, like I mentioned, the erythropoietin, the leukogen. There'll be some others used to help promote the cells, knowing what to do, and to have something to grow onto. That's called scaffolding, which is this whole idea. We know we can grow human cartilage with human stem cells, but what you do is you put them on a framework. You basically have a scaffold for them to build on. If you do that in a dish, you can grow cartilage, and it will be cartilage that belongs to whoever's DNA you used in the stem cells. Okay? It's actually been used therapeutically, but the problem is in order to make that happen, you have to open up a knee and paint the scaffolding on, and so you might as well do a knee replacement, because it's this bigger surgery knee replacement was. So right now, it's not a practical solution, but scaffolding is an important concept. So, this is investigational. And here's the thing, don't let anybody ever tell you or confuse you by saying their stem cells are FDA approved. They'll never be FDA approved if you're going to use your own cells, because the FDA has no approval power over surgeries. They don't regulate surgeries, they regulate drugs. These aren't drugs, these are surgeries through on tissue. So no one's ever going to have an approved, FDA-approved stem cell. It does show great promise. It is able to be done in the office under local anesthesia, and many types of patients can benefit. And we're going to see many ways of improving in the future. So now I'm going to turn over to Dr. Davis, and he's going to tell you about some of his cases, and we need to switch to the other slide program, please.